Hey, this is Mason Haley with Wahpeton Family Dentistry. Our goal is to take the fear out of dentistry and help patients make informed decisions about their oral health. Why missing teeth affect more than your smile? Today, we're talking about a topic that sounds simple at first: missing teeth. Most people think, well, I'm missing a tooth, but it is in the back. No one can see it. I'm fine. And I get it. If a tooth is not right in front, it may not feel urgent. It is not like losing your car keys where your whole day stops right away. A missing back tooth can feel more like losing one sock. Annoying, but you can still get through the day. But here's the thing. Teeth are not just for smiling in pictures. They help chew, speak, and keep your bite balanced and protect the shape of your jaw. When one tooth is gone, the rest of the mouth notices. Sometimes slowly, sometimes quietly, but it notices. So today, we're going to talk about why missing teeth affect more than your smile, what can happen when a tooth is not replaced, and what options you may have. As always, this is general information. Every mouth is different, so the best answer for you depends on your health, your bite, your bone, your goals, and what's realistic for you. So, let's start with the basics. Your teeth are a team. Think of them like players on a basketball court. If one player leaves the game, everyone else has to shift around. Someone has to cover up more space. Someone gets tired faster. The whole team can still play, but it may not work as well. Your teeth work the same way. Each tooth has a job. Some teeth cut food, some teeth tear food, some crush and grind food. They also help hold each other in place. When one tooth is missing, the nearby teeth can start to move. The tooth behind the space may tip forward. The tooth across from the space may grow or drift down into the empty area. Your bite can change. This usually does not happen overnight. It is more like watching grass grow. You don't notice it each day, but after enough time, things look different. This is the reason we take missing teeth seriously. It is not just about the empty space. It is about what the empty space can cause later. One of the biggest things people notice with missing teeth is chewing. You may start chewing more on one side. At first, this may feel normal. But if you chew mostly on one side for too long, that side of your mouth does more work. The teeth on that side may wear faster. The muscles on that side may feel tighter. You may even start avoiding certain foods. Some people say, I just don't eat steak anymore, or I avoid nuts, or I cut everything smaller now. That matters because eating is not just about getting through a meal. It's about nutrition and quality of life. Missing teeth can make it harder to eat a wide variety of foods, especially certain foods like crunchy fruits, vegetables, meats, and other healthy foods. And let's be honest, no one wants to lose a tooth and then have a salad become a full contact sport. When chewing is harder, people often choose softer foods. Softer foods are not always bad, but of course, many soft foods are more processed or higher in sugar and simple carbs. Over time, that can affect both your dental health and your overall health. Now, let's talk about your bite. Your bite is the way your upper and lower teeth come together. A healthy bite spreads chewing forces across many teeth. That helps protect each tooth. When a tooth is missing, the bite can change. Other teeth may take the force. Teeth can shift. A bite that used to feel even can start to feel uneven. This can lead to sore teeth, tooth wear, chipped teeth, or jaw/muscle soreness. It can also make future dental work more complicated. Here's a simple way to picture it. Imagine a table with 4 legs. If one leg is missing, the table may still stand, but it is not stable. You may put a stack of books under the corner. You may avoid leaning on it, but the table is not working the way it was made to work. Your bite is similar. When a tooth is missing, the mouth finds a way to adapt, but adapting is not always the same as being healthy. This is one of the most important points. Teeth like to have neighbors. When a tooth is removed and there's an open space, the teeth next to that space may drift or tip. The tooth above or below that space may also move into it. This movement can create food traps, and food traps can lead to gum problems or cavities. It can also make it harder to clean. And if you decide later that you want to replace the missing tooth, the space may no longer be the right size. A simple replacement can become more involved. Sometimes we have to fix the bite, move teeth, reshape teeth, do extra treatment just to create the necessary room for replacement. This is why timing matters. Replacing a tooth sooner is often easier than waiting years and trying to undo changes after they happen. This next part surprises a lot of people. Your jawbone needs stimulation to stay strong. A natural tooth gives that stimulation through its root when you chew. When the tooth is gone, the bone in that area does not get that same signal. Over time, the bone can shrink. This is called bone loss or bone resorption. Think of it like it's a muscle. If you stop using a muscle, it can get smaller. Bones around teeth can act in a similar way. When the tooth root is gone, the bone may slowly change shape. This matters for a few reasons. First, bone loss can change the shape of the gums and the jaw. Second, it can affect how the face is supported. And third, it can make some replacement options, like implants, more difficult later. Implants need enough healthy bone for support. If too much bone is lost, a patient may need bone grafting before an implant can be placed. Not always, but sometimes. So, when we talk about replacing missing teeth, we also talk about protecting the foundation. Missing teeth can also affect speech, especially front teeth. Teeth help guide the tongue and lips when making certain sounds. Even missing back teeth can affect how confident someone feels when they talk, laugh, or eat in public. I never want patients to feel embarrassed about missing teeth. Life happens. Teeth can become lost because of cavities, gum disease, injuries, cracks, medical issues, or sometimes because someone had a bad dental experience years ago and avoided dental care. There's no judgment here. Our job is not to make someone feel bad about the past. Our job is to help them understand what is going on now and what choices they have moving forward. And yes, smiling matters too. A smile is not just cosmetic. For many people, it affects confidence, photos, job interviews, dating, family events, and even how freely they laugh. When someone tells me, I just want to smile again, that is not vanity. That is quality of life. Missing teeth can affect the jaw joints and the muscles. Some patients with missing teeth start to notice jaw soreness, headaches, or muscle tightness. Missing teeth are not the only cause of those problems, but they can be part of the picture. When the bite changes, the jaw muscles may have to work differently. Some teeth may hit harder than others. The jaw may shift to find a comfortable spot. Over time, that can lead to muscle fatigue. It is like walking with one shoe slightly taller than the other. You can do it, but your body may not love it. Again, this does not happen to everyone. Some people do well for years without a missing tooth. But as a dentist, I want patients to know what can happen so they can make a thoughtful choice. So, what are the options to replace a missing tooth? Let's talk about options and solutions. There are a few main options: an implant, a bridge, a removable partial denture, or sometimes monitoring the space. Option 1 is a dental implant. A dental implant is a small post that goes into the jawbone and acts like an artificial tooth root. After it heals, a crown is attached to it. The goal is to replace the missing tooth without attaching to the teeth next to it. Implants can be a great option for many patients. They can help with chewing, they do not get cavities, and they help support the bone in the area. But they do need healthy bone and gums. They also take time, planning, and good home care. An implant is not magic from the Tooth Fairy's industrial division. It needs cleaning and checkups. Option 2, a dental bridge. A bridge uses the teeth next to the space for support. Crowns are placed on those teeth and a replacement tooth is connected between them. A bridge can be a good option when neighboring teeth already need crowns or have large fillings. It can often be completed faster than an implant, but it does involve the teeth next to the space, and it must be cleaned carefully, especially under the bridge. Option 3 is a removable partial denture. This is a removable appliance that replaces one or more missing teeth. It can be less expensive than the other options and can replace several teeth at once. The major downside is that it comes in and out. It may not feel as natural as fixed teeth. Some people love it and some people tolerate it. It depends on the patient, the design, and the situation. Option 4 is to leave the space and monitor it. Sometimes that is reasonable. Not every missing tooth must be replaced right away. For example, if a wisdom tooth is removed, we usually don't replace it. If a tooth was not in function or the bite is stable, monitoring can be okay. But this should be a planned choice, not just something that happens because no one has explained the risk. What about cost? Let's talk about the big elephant in the room, cost. Dental treatment can be expensive. I know that. Replacing teeth takes time, materials, lab work, planning, and follow-up. It is not like buying a pack of gum at the gas station, but it is also important to think about cost over time. Sometimes waiting can make treatment more complex later. A space can shrink, bone can shrink, other teeth can break or shift. A smaller problem can become a bigger one. That does not mean you should panic. It means you should get information early. A good dental visit should help you understand your options, the pros and cons, the timeline, and the cost. Then you can make a decision that fits your life. We never want patients to feel pressured. We want them to feel informed. If you're already missing a tooth, one of the best questions is, how do we protect the teeth I still have? That starts with regular dental exams and cleanings. It also means treating cavities early, managing gum disease, wearing a night guard if grinding is the problem, and keeping up with good brushing and flossing. If you smoke tobacco, that can increase the risk of gum disease or tooth loss. If you have diabetes, keeping blood sugar controlled can also help protect your gums and teeth. Home care matters. Brushing twice a day and cleaning between the teeth is not exciting, but it works. It is like changing the oil on your car. Nobody throws a party for it, but skipping it can get expensive. When should you ask about replacing a tooth? You should ask as soon as a tooth is lost or as soon as you know it may need to be removed. The best time to talk about replacement is often before the tooth comes out. That way, we can discuss whether a bone graft is helpful, whether an implant is possible, and what timeline makes sense. If your tooth has already been missing for years, still ask. It's not too late to learn your options. We may need an updated X-ray or a 3D scan to see the bone and plan the future treatment safely. The key is not to guess. Let's look, talk, and make a plan. So, here's the big takeaway. Missing teeth affect more than your smile. They can affect your chewing, speech, confidence, the bite, the jaw muscles, the nearby teeth, and the bone that supports your mouth. But the good news is that there are options. Implants, bridges, partial dentures, and careful monitoring can all have a place. The right answer depends on the person. At Wahpeton Family Dentistry, our goal is to take the fear out of dentistry. That means we want to explain things in a way that makes sense. No pressure, no shame, just clear information and a plan that fits you. If you are missing a tooth, or if you've been told a tooth needs to come out, come talk to us. The sooner we look at it, the more options we usually have. Thanks for listening. This is Dr. Mason Haley with Wahpeton Family Dentistry. We'll see you next time.